So welcome to Module 9. This is where we're going to focus on HIV testing and early detection. This is one of the most important tools in HIV prevention and treatment because people cannot access care or make informed decisions if they don't know their status. And they're going to delay because of fear, shame, anxiety, stigma, mistrust of the healthcare system, or maybe they have concerns about what a positive test result means. So as addiction counselors or behavioral health professionals, we're going to encounter clients who have never been tested, or they're afraid to get tested, or they're avoiding healthcare entirely. And we're not responsible for performing the HIV testing unless we're specifically trained and authorized through a particular role or agency. But counselors often play an important role in educating clients and reducing the fear, and we're encouraging the healthcare engagement and providing referrals to testing resources. So we're going to talk about all of this stuff. The goal is not to pressure our clients or create fear. It's to promote informed decision making and reduce stigma and encourage access to care. So early detection is really important. That's when treatment's most effective. And when we identify it earlier, the treatment can start sooner, the viral load can then be reduced, the immune function is protected, and long-term health outcomes improve significantly. When you know your status, you can make more informed decisions about your health care and your relationships and prevention strategies and reducing that transmission risk. People living with HIV today maintain healthy and productive lives because they were diagnosed and they were treated before the severe complications developed. But some people, unfortunately, avoid testing for years because of that fear or that stigma. And that virus continues affecting their immune system without the obvious symptoms during that time. And this is important because HIV can remain asymptomatic for a long period of time. And the client's going to say, I feel fine. I must not have HIV. And, feeling healthy doesn't necessarily mean infection is absent. So we have to help the clients understand that testing is about information and healthcare access. It's not about punishment or judgment. So there's several methods used to test for HIV, and some tests involve blood samples, other are oral fluid samples. Rapid tests provide results pretty quickly, sometimes within minutes, depending on the testing method used. Other tests are processed through laboratories and they take longer to return the results. Different tests look for different indicators, like antibodies or antigens or the virus itself. So we don't need to be experts in the medical testing technology, but we do need to understand the general process and help reduce the client confusion and anxiety. We might feel intimidated by the medical terminology or fear the testing process itself. The clients are going to fear that. And so people avoid testing and they fear the judgment from the healthcare providers. So we have to support them. We have to normalize these testing conversations and give them accurate information, reduce those emotional barriers. An important concept in HIV testing is that window period. That's the time between HIV exposure and when the test can reliably detect infection. Different tests have different windows depending on what the test is measuring, and that creates confusion or anxiety for clients. So a person who tests shortly after a possible exposure may need to follow-up test later because the infection may not be yet detectable. So we need to avoid giving specific medical advice about timelines unless we're qualified to do so. We need to understand the concept, and that's going to help us explain it to our clients. But the clients are going to have anxiety after the possible exposure, and they're going to be highly emotional and fearful and overwhelmed. So we have to remain calm and just encourage them to seek professional medical guidance rather than attempting to interpret the testing details independently. Don't try to Google your symptoms. The role of a counselor is to support, educate, and refer. We're not diagnosing. And a lot of people avoid HIV testing because of the emotional barriers rather than the lack of the access alone. Fear is one of those biggest factors. They fear the positive result or, rejection from family or friends or social stigma or discrimination or just feeling overwhelmed emotionally. If I don't get tested, I don't have to face it. Avoidance that temporarily reduces the anxiety, but it delays healthcare and treatment engagement. And, some clients have experienced discrimination and racism and stigma and trauma and judgment and all these things in the past in healthcare settings. And so they may distrust the providers, or they feel like they're going to be treated poorly. And so we got to address these concerns with empathy rather than frustration. Testing avoidance often connected to fear and emotional survival strategies rather than just simply irresponsibility. Substance using populations face additional barriers when related to HIV testing. They're struggling with avoiding the healthcare appointments, fearing the legal consequences, unstable housing, lack of transportation, prioritizing the substance use over their own survival or their preventative care, and that fear of judgment is common there. They think that we're going to stereotype them or dismiss them or shame them. So we have to create this emotionally safe conversation that's going to help them to engage in testing and healthcare services. They're more likely to seek care when they think that they're going to be treated with dignity. And receiving a diagnosis can be emotionally overwhelming for some people. They're going to go into shock or fear or just become numb or angry. They're going to feel sadness or guilt or hopeless or helpless or whatever other emotions they may feel. Some people just feel relief because they finally have clarity or an answer. So we need to avoid making assumptions about how they should react. Their response is going to be shaped by their personal history and their cultural beliefs, the family they grew up in, their prior education, their trauma experiences, their support systems, their understanding of HIV and what it does. So we are not expected to provide medical treatment after diagnosis, but we can provide the emotional support and the appropriate referrals. We just need to communicate that HIV treatment has improved dramatically and that support and healthcare options exist. And confidentiality is extremely important when we discuss HIV testing and diagnosis because people fear gossip, exposure, discrimination, breaches of privacy, and we have to maintain professionalism and follow confidentiality laws and ethical standards very carefully. Clients are more likely to discuss sensitive concerns honestly when they think that their information is going to be handled respectfully and appropriately. Even subtle breaches of trust or careless comments can damage therapeutic relationships significantly. So we need to avoid discussing client health concerns casually with coworkers or in public settings outside of the appropriate professional context. Respect for privacy is a major component of stigma reduction and ethical care. Also, even if a client is passed out in your floor, or they're having a medical emergency, you still cannot disclose their HIV status. It's the most protected thing. If I'm doing an evaluation and somebody discloses HIV status, I just say simply that they're dealing with a chronic condition. That's it. And we play an important role in helping our clients feel more comfortable discussing HIV testing and prevention. So we want to normalize testing as part of healthcare, give them accurate information, encourage the medical follow-up. We're helping to reduce the shame here. We want to make referrals to healthcare providers or testing resources, and we are remaining within our scope of practice and avoiding interpreting any medical results independently unless you are trained to do so. Your role is not to pressure or to diagnose the clients. We're just simply here to educate and support and encourage informed decision-making and promote their safety. Calm, respectful communication. That's the thing across the board. And so as we're closing this module, just remember that HIV testing is an important tool for prevention, treatment, and long-term health. A lot of clients experience fear, shaming, anxiety, and mistrust surrounding the testing, and we play an important role in reducing those barriers through respectful and non-judgmental communication. Early detection is going to improve the outcome, it's going to protect the immune functioning, and increase access to effective treatment and support services. So in the next module, we're going to discuss prevention strategies, including PrEP, PEP, which is PEP, safer sex practices, and harm reduction approaches in behavioral health settings. So when you're ready, proceed to Module 10.